had to sit down and come up with ideas that I thought would really be of importance in handling diabetes at its initial stages, as well as easy identification of diabetes at the very primary levels. Yes, and I'm very glad that I won these because I'm really very passionate about diabetes and also hypertension.
I learned of the Merck Diabetes Award through posters and online. The theme caught my eye, make every day a diabetes day. Diabetes is an increasing problem in my country, Kenya. This award will greatly enhance my career and will help me in the management of my future patients.
I participated in the Merck Hypertension Awards 2016, the theme for the Hypertension Award in particular being what the healthy heart needs. My concept paper was titled The Healthy Heart Handbook. I'm very excited to have won the Merck Hypertension Award 2016 because I am very interested in the area of non-communicable diseases and in particular hypertension.
My idea of treating hypertension is by primary prevention. If we concentrate at raising the awareness of hypertension, will go a long way in reducing the rise of hypertension in the society.
Diabetes and hypertension are silent diseases that we know little about, that the public knows little about. So most patients tend to present late. Once patients are diagnosed, they really don't adhere to their medications as well.
We are very poorly resourced, and therefore because of that fact, we end up having to handle the disease at its very late stages because patients will wait until when they can't really do anything about it. That is when they decide to visit a medical health officer or healthcare provider.
The Merck CMA is a highly anticipated event at the University of Nairobi every year because it's a great opportunity for people to expand their knowledge of diabetes and this year hypertension.
Today when I came to the Merck CME, I planned on refreshing my knowledge about diabetes, hypertension, learning as much about it as I can that was not classroom based, that was practical based, and I think my expectations were well met.
In addition to that, it also sparks students' interest so that we can then go and do further research and expand general knowledge on these two important conditions.
Coming to this CME today, I had very high expectations, given that I also attended past CMEs for Merck. I was looking forward to having an in-depth understanding of diabetes outside the classroom, and I am very grateful that those expectations have actually been met.
We should have more of these organized by Merck because it's really building us and also building our careers on how we are going to have a different approach towards diabetes.
From what we learned today on the basic pathophysiology of diabetes, it's clear that I need to advise my patients on their sugar intake. I need to advise them on their diets and their lifestyles. This came out really clearly.
And we were given examples of a practical approach on how to deal with patients who have diabetes, and just to know that diabetes is a disease that is growing in caliber every single day, and it's something that we have to know how to manage.
I've learned today several new important aspects in the management of both diabetes and hypertension, which will influence not only my studies but also my research interests going forward in my career.
Today, during the Merck CME, I was able to learn that when you're dealing with a patient who's diabetic, don't just see them as a diabetic. This is someone who has a life and other factors affecting them. So when you're approached by such a patient, you need to educate them on the condition and not just think of them as someone you treat medically and get rid of.
I'll use what I've learned today to empower 1, my family, 2, my community, and 3, my future patients. In future, I hope Merck expands its CME and gives us more information on tropical diseases, especially malaria, tuberculosis, and HIV/AIDS.
This is going to equip students with very important skills in their training as well as in their future practice on how to easily identify these diabetic cases at their early stages, as well as how to promptly initiate management.
This will really make a big difference in the lives of patients and will improve care.
I would like to thank Merck for the many opportunities they provide us students at the University of Nairobi, not only through their CMEs, but also through this Hypertension Award, which is greatly increasing capacity in the management of non-communicable disease.